This episode of The Dental Guys is brought to you by the Dental Crafters Network, your implant restorative connection. From surgical planning to patient-specific guides, quality implants, and final restorations, the Dental Crafters Network provides one relationship with infinite possibilities. Call 1-800-472-8302 today. That's 1-800-472-8302. You're listening to The Dental Guys, episode 50. Don't screw up the one screw test. In this episode, Brad, the dental lab guy, returns once again to discuss full arch implant dentistry. He brings a list of his top 5 most common errors in full arch implants that can sink a case, plus his top 3 material choices for these restorations. What's best? Acrylic teeth popping off left or right? Or zirconia hybrids breaking in half? We settle all this and more, including the return of the product of the week, on this episode of The Dental Guys. Welcome to this week's episode of The Dental Guys. I'm John, the Dental Guy.
And I'm Wes, the Dental Guy. John, it's that time of year again to be planning. I can't believe we're talking about this. It's here again, the Voices of Dentistry. Now, last year was the first event, and they had it in Nashville, Tennessee, which is right in our backyard. But this year, we're kicking it off in January again. And if you'll head over to thevoicesofdentistry.com to register for the event, it's going to be in one of our favorite places in the United States, Scottsdale, Arizona. And John, it's in January. So
yeah, January
fantastic.
In Scottsdale is about the nicest time to be there. And it is going to be right in the middle of a beautiful area, Scottsdale there, right at the Doubletree Resort. A very nice area and about the best time you can be there. And as Wes said, you know, you can register for this now. In fact, up until mid-September, this is going to be a special discounted rate. So if you're already past that date, you might pay a little bit more. But if you register right now, when you listen to this, go to voicesofdentistry.com and get registered, because we would love to spend some time interacting with the people that listen to us and hearing your feedback, getting you maybe even on the show. Like last year, we were able to talk to some pretty amazing people, both on the show and just people that were hanging out. We learned a lot. We had a lot of fun. This is going to be a great year, Wes. And based on the turnout last year, this is going to be a big deal.
This is a pretty big deal. January 26th and 27th, the Voices of Dentistry. Check it out, voicesofdentistry.com, and register right now. Hey, if you want to meet the dental guys, John and Wes, and maybe meet a bunch of other podcasters as well, we're excited to be there. We're going to be bringing all of our equipment. It's going to be a next-level broadcast, John.
Yeah, I'm excited about it. And, you know, speaking of feedback from wanting to interact with our listeners, you know, one thing we have been hearing a lot in the last couple of months especially has been people asking for us to bring back the product of the week. And, you know, we've done the product of the week several times. And, you know, we kind of got away from it just because we were doing kind of these bigger topic things. But, Wes, there's been a ton of people asking for it back.
John, I really appreciate our listeners. I want to say thank you so much. We recently just hit some milestones that John and I are just really humbled by.
Yeah.
And we want this podcast to be the clinical podcast that you turn to, and we want your friends to turn to it. And here's why: is we want you guys to give us feedback on what you want to hear. And one of the things that we kept hearing, John, and we kept getting these messages, hey, can you bring back product of the week? Can you bring it back? And we're going to bring it back, and we're going to actually install it for the most part in every episode from here on out.
Yeah, because we know that you guys want, you know, things you can take to your practice today. That's what our show's been about. It's been about some really big picture things and some geeky stuff, but it's also about things that can make a difference for you in your practice tomorrow. And that's what the product of the week does, because these are products that Wes and I use that we know work. So today, starting with today's show, we'll be bringing it back. And I'm kind of excited about that because, there's a niche for that. There's not a lot of people that actually use the products that they're reviewing, I think,
Right.
when it really comes down to it. I've heard some very interesting things about what really goes on with a lot of these places that quote unquote review products.
Right.
And we're going to do it.
Not to mention any names.
Yeah, we're not saying anything other than just we've heard things, So
I'll be glad to review the coffee I'm drinking right now, John.
Oh man, I bet you already have reviewed the coffee that you're drinking. Oh, look
In
at
a
that!
Dental Guy-
It's a Dental
in
Guy's
it-
cup. That's
and it's
interesting.
in a Dental Guy's cup. And look who's on the cup. It's John and Wes.
Yeah, look at those beautiful mugs. Well, since you're bringing your stuff out, I showed you this before the show.
Hashtag.
Look at this. If you're in your car and you can't watch this right now, don't crash. But
Don't
trust me, you're
crash.
gonna want to see this. So I'm holding a lighted hashtag sign that's about the size of my big head right here. So if you're on the YouTube version, you're enjoying this right now. I know you are. So
Listen, hashtag next level. And that's what we're about taking it to the next level. Listen, we have some super exciting things that are going to happen the first part of January. We're not going to tell you guys yet, but it is getting intense behind the scenes. I'm not joking you.
I know.
When I say that we are just mind blown by what is going on for the dental guys, we want you to tell your friends, tell your family, your mom, your dad.
Tell your mom.
Dental
Definitely tell your mom.
Well, my mom wants to know, John, what's going on with the dental
I know.
guys.
My
And
mom's
so,
a listener.
Let me tell you right now what's going on with the dental guys. Is that back by popular demand, we are bringing back today, and I want to welcome Brad, the dental lab guy. Brad, it's good to have you again.
Brad.
Thank you so much for joining us tonight.
Hey guys, thanks for having me back. It's good to be here.
Yeah,
It's
we're
been a while,
excited.
Brad, where you been? Have you thought
It's
out?
been a while.
Are you?
Yeah, it's a short summer here where we're at, but yeah, we finally thawed out and we're about to go into the sub-zero again.
Oh,
so
man.
just be
Man.
patient.
So you've been working or something? Is that what it is?
We've been working.
I mean,
Yeah, we've been
I
working.
know that you don't really work that hard in a dental lab, so
Oh, not at all.
yeah,
No.
that's why all the stuff.
It's
I
like
get
everybody
sitting
out there.
around- right?
When you own your own business, you can come and go when you want. You make a ton of money,
Yeah.
just like everybody knows.
And
when you own
nothing's
your own
ever your
business, right?
fault. It's always
And
someone
never.
else's
It's,
fault.
yeah, you got no headaches.
Yeah.
Yeah. All the above.
Well,
you know how
we
it goes,
really
guys.
had great response when we've had you on the show in the past. And today's show, we want to focus on a topic that I know is near and dear to your heart because of, first of all, some of your direct interests and what your lab does very well. And that's full arch implant dentistry. It's also something Wes and I are very passionate about, and we've done a lot of discussion on the show about. And really, this is a great follow-up to those of you who have listened to the Darren Deester interview that we did from Spear Education, where we talked about full arch. And one of the comments that he made that we titled the show after was that the maxilla is the Wild West. And it was all in response to us asking him, well, what are some of the things that you think are requirements or necessities for good full arch implant treatment? And we heard about that from more of the clinical side. But Brad, we really want to hear about, from the lab side, what are some of the things that are causing problems that you're seeing on a day-to-day basis? And Wes, kind of the way we broke it down was we really wanted Brad to tell us what his main kind of first few 5 or 6 pitfalls or potential problems that he sees most commonly in the lab and how we can fix some of them. So Brad, why don't you just kind of start right into that? What are some of the things that you're seeing with your full arch implant cases that are problems, and then how can we fix those?
I want to start out with, I'll call some of the easier things that can be fixed from the listener's side. Let's start there. But, the number one is be patient. Quite often we're getting pushed as a laboratory, and I think the doctors are getting pushed from the patient side too. They want to get the restoration. They want to complete the procedures quick. But, the patient has to be controlled. They have to be managed by the doctor. Don't let them dictate that treatment. But basically slow down. Don't skip steps.
I'm going to interrupt here for just a second because I got to tell a little story because we'd like to bring it to the clinical and just say I'm finishing a case that I started almost a year ago. Now, it'll be a zirconium over a bar-wrapped acrylic. And we had to go back because the lab and I had talked about doing a few things that weren't lining up right. And you know what? I kind of felt bad for the patient because we're going to tell them it's going to be an extra few months to do a few little extra steps to get it just right. And you know, my assistant rolls in there and she's like, Wes, she says, don't worry about it. We're giving this patient an amazing restoration that probably will never have to be redone. She said, I'll go in there and just tell her. And you know what? The patient looks at me and she says, you know, people don't really realize what goes in to make it. This is the patient telling me this, what goes into making a high quality restoration. And getting the patient on board from the very beginning and letting them know it's going to be a very long process. Yeah, we could finish these cases in 10 weeks, John. And Brad, you've seen people try to do that.
Absolutely.
But,
yeah, you can try it.
But what happens, Brad? Tell us.
Generally, we end up going backwards anyways. You know, we skip steps and things don't fit. We're trying to get to the final procedure or final seating and things don't fit. Or things do fit and down the road, things break. And now we got to go backwards anyways. You know, so, you know, just be patient. I know they are time consuming, but, you know, that's an easy one to just make sure you don't skip steps. Yep. Make sure you follow the procedure and the protocol. Yep. And things always work out. You know, so that would be just an easy.
So number
fix.
one is be patient.
Yeah,
be patient.
It's good.
You know,
I like it.
Then we'll go down to the simple thing of making sure you take a good impression because everything starts with that impression. Some of the common mistakes I see is everybody gets so used to these really fast, quick set impression materials for single unit restorations is where they're really meant to be used. But when you're taking these big full mouth impressions over top of open tray impression copings, and quite often you're going to have a verification jig that you're even taking an impression around if you're going to do a verified impression, you need time. So use an impression material that has a little bit longer set time. It's always been my favorite, and I want to say it, guys. You know, my favorite is Improgum, 3M Improgum. That the slow set. It's a 6-minute set time.
Right. I think the working
just because it gives
on
you
that,
time.
The working
two and a half
time alone,
minutes.
It's
I
like
think
2.5 minutes, and it has a snap set, which is key. And I think Kittenbach, which is poly,
it's another good product.
Another good product. Their longer working time, heavy body, is about 1 minute and 20 seconds working time. So a little faster than Improgum, but still yet a 4.5 minute set time. But in some cases, you need the longer time to get the tray in the mouth, to get the tray loaded. I mean, how fast, if you don't have a Penamix machine, you can't use Improgum. I know you can use Identium without a Penamix machine, but they don't recommend it now. Why, Brad?
It's stiff. You know, that heavy body is really, really heavy body material. So trying to get it out of a gun, it's a workout. You know, so your assistant, they can't get it out quick enough.
So what you're saying is that the dentist needs to invest, if they're doing a full arch case, into probably a Penamix machine. John, I know you don't have a Penamix machine. How are you getting around this?
Just use long setting materials.
There you go.
You know,
so
I know you guys like your polyethers. They're great materials. They're great materials. I think that the new generations of VPS that are snap set, I use Imprint 4 for that reason. It's a great
good product, another 3M product.
Yeah, great working time.
Not a sponsor.
Yeah, yeah, that's right.
Neither's
yet, right? Yeah, but they, you know, Imprint 4 has got a really long working time, and the regular set of Imprint 4 has a 2-minute working time and a 4-minute set time. And you know, the thing that I like about VPS is it's a little bit more dimensionally stable for long term. So that's one thing that it has an advantage on. It's also a little bit easier to remove. Potentially.
So if you guys are listening to this right now, Wes has been trying to convert John. I've been trying to drive to his place because I have 2 extra Penamix machines. Yeah, I have 2 extra. Don't ask me how. But, John, I've been trying to get you to try for years now, and he will not convert.
It's you know, well there's another side of that, and that is that I have a bigger office, and
there we go. That's what I wanted you to bring up.
And there's other things than just, you know, you have to look at, first of all, is there a significant difference in these materials? Right. And I think that there is. If you're using as Brad said, a fast set material that's not meant to be used for full arch, you're going to have some significant issues. Is there enough of a difference in terms of accuracy with a high quality VPS, a high quality polyether? I'll think of it too. There's also a practical question of how many Penamix machines do you need to have? Do you want to be moving them around from operatory to operatory? An office that's set up for that, leaving it in one place, I think that's the way you have to go. If I did that in my office, I'd probably have to have 4 of them. And you start to get to where, inventory control. I don't take a lot of impressions now that I'm scanning. So if I'm going to have 4 Penamix machines, I might have to have 4 times the actual impression material too, because you don't want to be really hot swapping that out from the machine to the machine to the machine. So there's a little practicality as well.
Unless you're doing a ton of these cases per year, it just doesn't make the sense to, in a bigger office, maybe incorporate that. And that's the exact point that I wanted to bring up. I'm sorry to interrupt you, Brad.
No, that's it's a good discussion, because
it's a great discussion.
I think people need to be looking at that stuff. They need to be thinking, okay, there's a practicality aspect, but you can't just say, I'm going to buy one material and I'm going to use it for everything in my office. I mean, like I'm saying, people that just use, like you say, Brad, like a fast set. And that's what I got, so I'm just going to use it. That's a mistake.
Yeah, you can't do that. That's the mistake. Yeah, that's what's going on. Is like, hey, they call up Brad and they say, hey, I got this case, and let's treatment plan it. Let's do the case. And they get to the impression stage, and they're like, oh, no, it's impression day, and I didn't order the impression material. And what you get, Brad, what does it look like when you get it and they've used a fast set material? What does it look like when you get it?
You'll see pulls and drags all over the place where basically the heavy body isn't married with the light body because the timing's off. They didn't have enough working time so that either one of the two materials are already starting to solidify. So when they get married together, they don't really blend together.
Yep.
You'll see a seam.
Yeah, and you wouldn't know necessarily whether or not it's accurate. You just, in terms of did it really capture it? I mean, you look at those seams, you go, I don't know about that. So
if you see those seams, that's a bad news thing. Don't use it.
Yeah, even if it's in crown or bridge, it's an issue. So these are big cases, are expensive for all of us. So again, just look at your impression material out there, guys, and make sure you got something or order it in special for these big cases. I mean, you don't have to stock it all the time, but if you got a big case, even big crown or bridge case, we recommend that. That's like a 6 prep, 6 prep type application, 6 veneers or 6 crowns.
Yep.
So
agree.
So number 3,
the next one, number 3, verification jig done properly. So. Now as a laboratory, we're making verification jigs for the doctors. So we'll take a model after the impression's been taken. We'll pour a model. We'll make the verification jig, send it back to the doctor for the doctor to verify that the jig is seated. And we're fine as a laboratory doing it. But if you're going to ask me what the most accurate way for a doctor to do verification is actually if the doctor does it in the patient's mouth.
So let me go through that, Brad. What if you could do it any way you wanted? And the doctors would always do that. What material would you use? What would you send back to your doctor to use for the verification jig?
We use a kit called Easy Bar. It's just a kit that has look like little dumbbell bars with different dimensions to them, different lengths, and it's got a little measuring gauge. You literally just put in the cylinders in the patient's mouth. You measure between center of center. You pick the right little bar, and maybe some little modification to the bar, and then they slide right over top of those cylinders. So it's really a metal bar that joins everything together. And then you go ahead and use like a GC pattern resin or to lute everything together. But anytime you start to take floss and all these different materials, and you start taking these, in essence, they're not an acrylic, but the like the GC pattern resins. They still have some shrinkage factor to them, and things change. So we like to have the bars actually in metal.
Yeah, I mean, if you do it with GC pattern, you're supposed to do it and then section it, and then do it again in just the center, so you have the tiniest little amount. And we're going to talk more about that bar system later in the show. But I think that so why, and maybe this. So why don't you? Why don't you just send that to all your doctors?
Why don't we send it?
Yeah.
To all our
What do you get pushback?
The kit itself?
Do you get pushback from doctors if you were to send? Even if you're not that kit, but like let's say you sent back. Doctor says I want verification jig, and you send back, say 6 cylinders with blocks of acrylic, right? That all they have to do is join. What would happen if you did that? If you started doing that?
We would get pushback from the doctors.
And what would they say?
I want you to make the jig for me. It's easier for me to seat the jig that you make into the patient's mouth. And I would say, yes, it's easier for the doctor to seat it in the patient's mouth. I think it's harder for the doctor to verify whether our jig is actually seated or not.
Yeah.
So if you have a transmucosal abutment that's, let's say it's 2 millimeters sub G in an area for, we have the longest transmucosal abutment we can get, but it's still sub G.
Yep.
How do you verify that that bar is actually seated? Well, you can take an x-ray. Problem is it's metal on metal. And you guys know if you don't have it, a perfect x-ray from the side, it's hard to tell if it's fully seated. So you can take a probe and go down and see if you can feel a click or visible.
Right.
You visually see it. You can't see that. So if you, as a dentist, can take cylinders, individual cylinders, screw them down on a transmucosal abutment, they're seated. There's nothing holding them up. You just seat them on. And then make the jig joining those cylinders in the patient's mouth and send that to me and let me verify that it's correct on the model. And if it's not, I'll cut an analog out and I'll make it correct. That is by far, I think, I know it's the most accurate way. Does take the doctor a little bit more time, but hey, is it worth it? I think it's worth it, because if it's not verified and we don't verify correctly, we basically made a restoration that's not going to fit in the end.
And let's talk about, and I also want to just add, I know we talked about this a little bit before the show, the one screw test. If you don't know what the one screw test is, I would say you maybe shouldn't be doing this. But what the one screw test is, for those of you, maybe that's harsh because maybe you just are getting into this, but what the one screw test is, if you join all those cylinders together, or say the lab does send you a verification jig that's all joined, you put it in the mouth, you screw the most distal screw in. So if it's, say, 3 through 14, you got 6 implants, you put it in the number 3 implant, and when you screw that screw in number 3, if number 14 pops up,
you're in trouble.
You're in trouble.
You're in trouble.
And what you do is you take your finger and you go over to number 14 and you push on it. And if you see any movement, you feel any movement, fail.
You're done.
Then you
need to
go
ahead and take an impression.
Then you take it out of number 3 and you swap it over to number 14 and you do the same thing again. You should be doing that on every verification jig, even if you lute it yourself. When you're done and you're unscrewing your screws, unscrew every one except the last one on one side. Do a one screw test real quick. And you're right, Brad. The x-ray lies. And the one screw test, I'm not saying it's perfect because sometimes you don't see movement, but man, it's pretty darn good, because if you can usually look at the contralateral side and see if it's up. And if you see it up, you're off. And do not, like Wes said, it's time to take a new impression or reconnect your cylinders and take a new impression. And that's a test that it's interesting because the couple of times that I've lectured on full arch, and I've had people like, well, who can tell me about the one screw test? What's that? And I've only had maybe 1 or 2 people ever even know what that is. So, gosh, the verification step. Brad, what can happen if you don't have a verified model? What kinds of things can happen to your restoration at the end?
Fracture. Doesn't fit.
And what would you? And on the 2,
I don't know why I'm laughing. That's a bad thing. I guess I'm laughing.
That's a bad day.
Do you think you can? Let me ask it this way: do you think that zirconia will ever not fracture if you have a bad verification?
It depends how big it is, but it's super thick.
Bend it.
Does zirconia bend very well?
It doesn't bend. It fractures. It breaks.
Titanium bend.
So
maybe a little. You can maybe get away with this a little bit on titanium, but you will not get away with it on zirconia.
You will at all. Not at all.
So if you're doing these nice, beautiful full arch zirconia restorations and you're not doing good verification, you're basic. You're just wait. It's
a time bomb.
You're going to break stuff, man.
It's a time bomb.
Yeah.
So with the zirconia restorations, it's a metal cylinder and it's luted in there with cement. We've gotten lucky in the past. I've had some cylinders break out of the zirconia. So what does that tell you? That tells you that it wasn't verified, but the weak link was the cement between the zirconia. I've had a few of those happen.
That's a much better failure.
Unfortunately, it's a much better failure because then we can redo a verified impression and relute the cylinder. But I've had a few of the zirconias actually just fracture, and we've always tracked it back to a verification issue because we've started over with a new impression, a new verification jig. We dotted our I's and crossed our T's on a new verification jig, and sure enough, the old restoration wouldn't fit the new model. So what does that tell you?
Yeah.
It
and then you're
wasn't
done
verified,
at that
so-
point, right? Because you
Yep,
really,
yeah, it's a start over.
Yeah, it's a
You
start
know, you
over.
have to start
because you
over.
really
there's
can't,
one more.
you really can't
Okay.
There's
reload
one
it.
more way here, guys. I want to tell you that, I don't want to freak the doctors. I'll say, wow, I got to do everything chairside now. These guys are telling me there is another alternative
How much
that
you
I can
charge?
help you out with as a laboratory. I can make a verification jig for you guys on the model. But before I send it to you, I actually section the bars all the way through. So you actually have separate pieces where the bars are almost touching.
Love it.
So then you still can seat the cylinders, but there's bars attached to them. There's going to be a gap between them. We send a little kit along that you actually will be able to lute that together. That comes with the verification jig, so it lessens some of your time.
Yeah, and it takes away a
but-
little bit of the stress of getting pattern resin, say, into a screw access or something, because you're not
Yep.
even near that.
Yep.
Yeah, it's
we
so
do
much
that quite a bit.
easier to do that than it is to, start from scratch. And
Correct.
if you're not experienced, I think that probably right there, what you guys just said, is probably the best way, is for the laboratory to make a verification jig, section it, you get it back, and then all you have is a small 1 to 2 millimeter gap
Yep.
that you have to basically flow some type of pattern resin in, and therefore you're spending very little time if you in the mouth at all.
It's not stressful.
And I think that's a great tip for a new dentist or somebody that's looking into this, is that let's get the lab to fabricate something, section it, and then you relute it in the mouth, and then they can send that back. You can send that back to the lab, and then they can reset your
analog,
analogs
yeah.
based off on that. Now,
And I'll say
Brad,
one
let's-
other thing too, because you mentioned patience, Brad, and I just think while we're on the topic of verification, you mentioned as before the show that there's people wanting to skip steps sometimes, and I have had people that will say, "Well, okay, I know a guy that works at Clear Choice, and they don't do verification jigs." I have heard someone say that before, and you know what? You're right. They don't. And what they do is they use the provisional as a verification jig. So if you really learn how to do this amazingly well and your provisional is absolutely spot on and you are 100% confident, that might be some next level stuff that you could do. But you
that's next
pretty
level
much
because
have
you're doing hundreds a month.
hundreds, and you pretty much need to have a lab technician in your office to be able to accomplish that right, because
That's
you're
the
going to
kicker
have to
right
take
there,
it from the
my friend.
patient for a little while. You're going to have to pour a model. And so these are just things, when I've heard people say, well, Clear Choice doesn't use verification jigs. Well, yeah, they do. They just don't do it the way that you think they do it. They're not actually skipping steps. They're just doing it in a way that's more efficient because they have a lab technician. Brad, if you were in my office every day, we wouldn't have to do some of these steps, but that doesn't mean that in the typical day-to-day practice that you can skip steps. You just can't skip this step.
And I think you said it best, John. You're not skipping them. We're just doing things in other ways to be more efficient.
Yep.
Because if the provisional's already in there, we know it fits because we luted the cylinders to the denture that day. We know it fits well. We just grab that, transfer that to the model, reset analogs to that, and that really is your verification.
Yep.
There you go.
And if
You
you
know.
got time in a lab technician, that's awesome. But
Absolutely.
in the typical office, it's just not like that. So
And most of my customers are coast to coast, so we're mailing back and forth. So we're always trying to figure out ways to make it a little bit more simplified for the doctor.
yep.
Okay, so number 4.
Number 4, it's just a problem that we have with one particular product, and we're going to talk a little bit more, I think, later about different products for this. But when you do bar wrapped in acrylic, it is an issue with teeth falling out, and quite often I'll get the call going, Brad, what's going on? Your dentures are bad, your teeth aren't sticking to the acrylic, and I get the denture back, and it's not that it's not stuck, it's broke. The teeth's literally broke. So the acrylic stuck to the base part, but it fractured right off, kind of at the gum line, if you would, or acrylic line. You guys got to remember that we took all proprioception away from these patients. They don't know how to stop chewing anymore, or how to stop biting. So when you throw a bar wrapped in acrylic there, and the patient is biting on those implants, something's going to break because nothing's telling them to stop. So, and then just more of a point of view, and we'll talk about that a little bit more with some of the products. But that's a disadvantage. But I just want to put it out there. Don't get mad at your lab guy in thinking that his product is failing. A lot of times it's proprioception. Sometimes it's a setup. And again, skipping steps, I don't quite often see enough time put in to the setup, going through function, phonics, occlusion, to make sure that we're in the right position before we go ahead and process the dentures.
Do you think
Everybody's
sometimes
always trying to
too
rush
that's
too.
just a lack of occlusal clearance, not giving you really a big
Quite
enough
often it is.
enough tooth and enough acrylic?
And then
It's funny you mention it, John, because that's my next.
Oh,
that's my next one.
nice.
So you hit it up.
what in
So
the world
lack
are you
of-
guys doing over there? Are you guys like
Yeah.
talking to each other? or
I
something?
didn't use sign language or anything. We
What
just
a segue.
I'm texting him in
Number
the background.
Number five.
Number 5 is occlusal clearance.
Oh,
you know,
man.
the lack
Video,
usually. Usually it's the lack of occlusal clearance. You know, so we're just don't have enough inner arch space to be doing different types of products. And when
So
you're
how
doing
does
a
this
bar
even
wrapped in
happen, though?
acrylic-
I mean, like, seriously, in this day and age, with all the CT planning that we've done and all the pre-model work and pre-model surgery, how does this even happen?
You know, it's a skip. I don't know if it's skip step. It's overlooked quite often. But when we're planning ours with on the surgical software, we're always asking, what product are you looking to present to the patient, and then we start talking about occlusal clearance right away at the surgery stage, because that's where it needs to happen. It really has to be. It has to be addressed at the surgery stage.
Because once the
which-
implants are in, you can't increase the vertical dimension.
Unless you're going to open vertical. I'm
Well,
just
and-
literally hinge open. You know.
So basically, you're hinging at that
You're
point.
hinging. You know, so then other issues can be caused, as you guys know, by that. So we always like to address it on the surgical stage and make sure we got enough clearance from the bone side. Because if you're going to do surgery, and this is I'm merging. This is kind of my next top one that we're going to talk about. But it's bone preparation during the surgery.
So number 6 is bone preparation.
It's bone preparation. So for 2 reasons. One, John, you and I are already talking occlusal clearance to make sure we can hit our prosthetic in there. So a product that's requested quite often is a conus connection. So everybody conus, and it's it's a great concept. Don't get me wrong, I like the concept. The problem is you need some pretty good occlusal clearance. And quite often I'm getting these cases and I just don't have enough vertical to do it. So if you want a conus connection, we better be looking on a surgical stage. And when we place the implants, we'll place the implants deep, and then we'll actually do a full flap, and we'll flat top, I'll call tabletop, grind the bone down to give us more vertical or more clearance in the vertical. So that's one reason that we want that. The other reason I like to see the flat top table is cleansability. I think we've all learned, we've had these discussions, in early stages of doing these, we were doing more of a ridge lap concept, so we had buccal and lingual ridge lap. Well, we thought we were going to get away with it with zirconia because, it doesn't harbor bacteria, but bottom line, you guys have taken these off. It's better than acrylic by far, but they still can't clean them real well.
I think
so we're always trying to make them more
key.
cleansable, right?
Yeah.
So if you look at it from my stage, if I got a round ridge, how do I make a prosthetic that's round on round? You know what I mean? The taglio portion that's seating on the tissue, it's just hard to keep it cleansable without making it so food can get impacted in. So at the surgical stage, if you can flat tabletop that and make it more of a flat receiving area for the prosthetic, we're going to be able to come down and make it look more natural, feel more natural, and be more cleansable, but yet not have areas for food impact.
Man, you know what you just said right there? These last 3 things, teeth falling out of the bar, lack of vertical dimension, and bone preparation, are kind of all 3 in one.
Yeah.
Kind of, yeah.
They
they're
all
all
go hand in
connected.
hand, and these
Absolutely.
all can happen, John, in the planning stage.
Yep.
This can all be done virtually. Now, we're not saying that you have to spend thousands of dollars on an in-sequence bone preparation guide and these different stage drills or different stage guides that you snap onto the case, because that's very costly. But we know people that are doing this at a high level, doing hundreds of cases a year, that provide proper bony reduction for these cases.
Yeah.
And one would say, well, I want my case to look more like Crown and Bridge like. Well, that's fine, but you better plan for that and plan for segmental prosthetics and different types of materials, which we'll get into. But planning, John, don't you think?
Planning, and I think that it all comes back to something we've said so many times, which is just knowing where to set 8 and 9. And that's something that comes from your denture training first and foremost. It comes from facially generated treatment planning out of Spear.
Yep.
And it comes from just common sense here of if you don't know where 8 and 9 need to go and set everything based upon that, how are you going to go into surgery with any idea what you need? Because if you just go into surgery saying, well, I'm just going to base it, what are you basing it on? You're going to base it on just, what you feel like, or that looks pretty good, I mean, those are things that mean nothing. What you have to have is you have to have pre-planning, whether it be virtual planning, whether it be just good old-fashioned wax up on a model, figure out where 8 and 9 need to go, and then look at your clearance that you need. And you also need to communicate that to the surgeon. As Wes said, you don't have to have, the super complex guide systems. That's nice, but it certainly it makes it a little faster. But a good old-fashioned ruler, a perio probe, these are simple tools.
Let's just talk about it just for a second, and then we'll get into the next segment here. Hold on for a second. Like how can we do this analog? Okay, let's use a couple of little simple things. Get out your camera phone right now, even if you don't have a DSLR. Take a picture with somebody standing up against a wall with your camera phone, level with the plane of occlusion, and have them smile. Okay, have them smile. Take a picture, and then have them say the word Emma. Mm-hmm. Okay. And look at the lip reveal and the incisal edge tooth position. And then from there, you say, well, does it look long? Does it look short? Do you want your teeth shorter, longer, ever how you want? And then take that and transfer that information to the model and then go from there. And then set
pretty
your
much,
edge of 8
wherever
9.
your incisal edge position is now minus 14.
But that costs a lot of money and a lot of time.
Right. And that's something that anyone can do. And I think, Brad, do you think the problem is with this that this is this from the restorative side more, or is this the surgical side? Are the restorative docs, doing the planning and giving it to the surgeon, and the surgeon's just not doing it, or do you think that the restorative docs just really aren't doing the planning in the first place?
A lot of the guys starting out, I don't think are at the cover level of doing bony reduction. So, they want to be able to just put the implants in and restore and not have to do it. If they do it, then they feel like they got to refer out, just maybe because their surgical skills aren't quite there, their confidence level isn't there yet. So we're seeing, the doctors who are newer, we talk about it and they're scared to do it. Then we see the next level, they're past that. So then we start talking about that. So there's 2 elements there. There has been some times that the specialists skipped a step, and we've talked about it on the prosthetic side. We planned it prosthetically. The information was given to the surgeons, and they just skipped that step. And I don't think anybody's doing it intentional. I just don't think that because they don't have to restore, they kind of forget there's a value to it, and they get going, and they just forget to do it. They all know how to do it, and they're good at it. I think it's skipped by accident.
Well, it's a perfect time to talk about if you're struggling with this, or you're trying to get it, whatever your level of involvement in full arch implant dentistry, you need to have someone behind you that understands the planning. We've talked about planning, all these steps that all these issues that Brad has brought up all really come back, most of them, to planning, or the majority of them. And we want to talk a little bit about one of the companies that we know can be the backup you need to be able to plan from crown down to the implant, and make sure that before you start your first or your 100th full arch implant case, that you have a plan in place. And that's Implant Solutions, Wes. I mean, they've been doing this a long time.
Yeah, so the dental guys, I went ahead because I knew we were going to be doing this episode, and I wanted, because we know that the planning is so key. We know that the vertical dimension is so key, and we know that the bony reduction is so key, that I went ahead and I called up the Dental Crafters Network and specifically asked for a promotion, and with Implant Solutions. Now, Implant Solutions is a company that has the ability to plan a multitude of different implants, whether you're using Astratech, Nobel, Straumann, Ankylos, or some kind of 3i, or even if you're interested in a new system like they provide at Argon, like the K3 implant. If you want to go ahead and plan a surgery, I called and I asked, I said, guys, can you offer some of our listeners something here? And they said, yes, we can, Wes, because we know that planning is key. And they said for the first, when you guys call and use and mention the dental guys, okay, they're going to give you a free treatment plan, meaning they're going to plan your implants on the case for free at no cost.
Whoa.
For free. And so call right now. That's what we want you guys to do because it helps us to be able to provide you with high-quality content by supporting Implant Solutions. And listen, they are high quality. Both John and I have used them on multiple occasions.
Oh, yeah.
And they understand it. They're using the top planning software in the world, Co-Diagnostics, and they pair that up with awesome treatment planning. So listen, Implant Solutions provides treatment planning and custom surgical guides for all implant systems. So I want you to call right now, 1-800-472-8302, and mention the dental guys and receive that free treatment plan for your next case.
And that really also, brings us into discussing the product of the week because, just like Implant Solutions is giving you something that is a solution here that can actually plan your case. We also need to go back to one of the things Brad mentioned, which was how do we have a verification jig that's accurate and something that's easy to use. And in the name,
and Brad, you're the reason why we have this in our office.
Yeah, Brad was the first one to introduce this to us, and the product is called ProTech Easy Bar. And Brad alluded to this earlier in the show when he said this is a product that basically it's small little titanium bars. They kind of look like little dog bones shape. And you have all these different sizes. You select the size, you place it over the cylinders, and then you just simply lute it to place. And this is something that when I first saw it, I thought, well, why has no one thought of this before?
It's amazing. It's amazing. Listen, product of the week this week is Fast Protect's Easy Bar. You guys asked for it. We brought it back. The product of the week, Fast Protect is not a sponsor of the show, but we love their product so much. And John and I both have it in our office because Brad saw it and brought it to us and says, guys, check this out. And we immediately just bought it. I mean, it would just made sense because it allows you to do verification jigs in the mouth when the patient's sitting there. All you need is some cylinders for your transmucosal abutments. And then these things, man, it's just amazing. It comes with a bunch of bars. You can check it out right there on our show notes. We'll put a link to the Easy Bar. And it turns out that you can, if you're wanting to buy this, actually I heard that the Dental Crafters Network actually has these for sale. So if you'll call and when you're talking to Implant Solutions, just say, hey, can you send me the Fast Protect kit?
Yeah.
And they'll sell you the kit. It's reasonably priced for what you're going to be able to use. You use it multiple times. That's what's great.
Yeah, and the little bars are really cheap. Once you buy the kit, to refill like a size of the bars is really cheap. I mean, they're like a 25 cents a piece or something.
Yeah. We love
for
it.
the actual little bars.
Yep.
And so getting back to this great discussion that we've been having, Brad. I mean, you've been really giving us a lot to think about. And one of the things that you mentioned earlier with one of the products you mentioned with bar and acrylic, that you were having teeth could pop off, and that was one of the downsides. I'd like to really go into materials a little bit, and I'd like for you to give us your top 3 material choices for full arch. And with each one, let's go through maybe what's your favorite, your second favorite, your third. And with each one, let's talk about why. Why do you like it? What are the good things about it? What are some of the drawbacks?
Awesome. I want to start out by my favorite, okay? And I do have 3 options for you guys. And this is something, there's a doctor somewhat local, Wes, you know him, Jan, taught me this technique. So if you have a patient that has existing teeth, periodontally involved, existing teeth, and you want to basically transfer them out of this and into all implants, so it's a full implant restoration, It's more of a hybrid technique, but you actually would take out the teeth through surgical planning. So you'd plan certain teeth to take out. You'd place implants in certain locations, and then you prep the adjacent teeth, and you would basically do a temp over the adjacent natural teeth, which allows the implants to go to sleep. You don't load them, okay? And then you would come back and you would restore over top of those implants, and then take the other remaining teeth out, place more implants, and let those go to sleep. And you would basically, you would put your temporaries over top of the first set of implants. So you're usually going to end up with 8 or 10 implants on a situation like this. But the reason that it's my number one is because it's crown and bridge-like. Okay, we're not doing any tissue lapping. We maintain bone because the bone's already there. We never lost teeth, so we don't have bone issues. And you maintain vertical. Mm-hmm. So I know you guys, we didn't discuss this a lot, and I don't think you guys have even done one of these, but we do a lot more of these because it's crown and bridge-like. It's highly cleansable, a little bit more expensive because you're generally doing 8 to 10 implants per arch.
And you're segmentalizing too, right?
And you're segmentalizing. So we'll do, 3-unit, 4-unit bridges, but it's cleansable, it's crown and bridge-like, and we don't lose vertical. It's been a phenomenal option, and we're not loading our implants right away, so we're not taking that risk.
I want to say one thing, Brad. It's not just a little more expensive.
It's a lot
more expensive. And
Absolutely.
I don't say that critically. I say that because it's just important to remember, especially if you're doing it the way you mentioned, because of the multiple sets of provisionals.
Right.
That and the fact that many times I've found on these cases, I've done a couple of them like this, you end up having to do endo on some of these teeth, because usually the teeth suck, and so many times you're doing elective root canals just for the sake of provisionalization. You're sometimes doing posts. You're doing things that are, on teeth that are hopeless, that you're going to extract. So you really have to get the patient on board with that. But I look at that, Brad, as a great option. In the end, it costs more, but it also allows a patient to spread out treatment costs as well over a much longer period of time. So it may cost more, but if some patients can afford $50,000 over 5 years, but they can't afford $30,000 all at once. And so sometimes it can be the difference between them saying yes or no. And as you said, there's a lot of advantages to this treatment in terms of the provisionalization. It's pretty easy. Provisionalization in terms of you always have something fixed. You don't have to worry about backup plans very often. There's not a lot of things that can go wrong, and who doesn't want to have segmentalized final restorations?
We have higher success rate of the implants because we're not loading them. So I just wanted to mention that.
Yeah.
It was worth mentioning because there's not a lot, I think, that do it that way.
I think it's good.
And it was taught to me by this very talented doctor, and we do a ton of them. But you're right. Everything you said, John, you got to take into account the treatment plan, the longevity, the cost for sure. But I wanted to mention that one.
Yeah, that's great.
Okay.
So your more conventional type all-on 4 / all-on 6 type situation is my number one, and the most expensive or more expensive would be the zirconia option. And we've talked about that. We do a ton of them. Zirconia is, we talked earlier, it doesn't flex. So if you have an error, it's going to break. We have had to have a few break in the past, but as long as the steps go according to how we want them to go and we verify, we've had very, very high success rates. Advantage of zirconia is it doesn't harbor bacteria, so it's a little bit, it's more cleansable. It's extremely, extremely aesthetic.
Mm-hmm. Mm-hmm.
So definitely number one pick.
Okay.
Going down from there is the good old bar wrapped in acrylic. So very, very commonly done. We do a ton of those also. We've already talked about the disadvantage of teeth breaking out of that. Don't throw the lab out with the bath water when something breaks. It's generally because they lost proprioception and teeth break.
Yep.
We'd rather have that happen than some part failure. But vertical again is all these need some type of vertical dimension that you gotta be aware of for these in your planning stages.
Yeah, and also too, I mean, some of the advantages I guess I see. You alluded to it. You have the failure point is a very favorable failure point. Tooth pops out, we can handle that.
Well, John, you and I heard this, and if you go back and listen to episode, John, what did we say that was?
Episode, goodness. Was it 38?
38. The AO recap this year is zirconium dead, or zirconium is dead as we know it? And the reason why we cast light into something like that, we don't think zirconium's dead. We think that zirconium is question. We need to question when we're using it, and we know that Dr. Picos, a talented clinician and surgeon, has now building in a fail point on all of his dual arch cases, meaning we're treating upper and lower at the same time. He's using zirconium for aesthetics in the maxillary arch, and he's using bar wrapped in acrylic on the lower arch. And he uses in sequence, and he uses in sequence because he wants to provide proper bony reduction for proper vertical dimension for the zirconium, and also to give you that flat tabletop look to your ridge, so that Brad can properly design this. So the people that are doing this are doing it with proper vertical dimension of occlusion, and they have less teeth breaking off. If you call up Brad and you say, I only have 10 millimeters to work with here, and you're not prepared to open vertical, or you can't open vertical, you're asking for failures. And I think that we'll go into more with our maybe in the next couple episodes when we bring back on maybe another guest, talking about this and what you need for vertical. But
and that's per arch, 10 millimeters.
Yeah, that's
per
arch.
Right. And that's where I think that bar and acrylic,
it fails.
It fails, and I think that's why it kind of gets a bad name. I really like bar and acrylic. I'm a huge fan because I like the repairability, and I know what it's going to do. I just know what it's going to do. You know, if I have teeth popping off repeatedly, it's my freaking fault. Okay?
Thank you, John.
You know, it's not the lab's fault. It's not the patient's fault.
Wait a minute. Stop right there.
For the first time
ever,
What
did you
Brad,
just say, John?
For the
what did you just say?
time.
John, I've always heard from you guys it's always lab's fault.
Every other time it's the lab's fault. Okay? Everything else that goes wrong in my office, don't get me wrong here, Brad.
Gotcha.
I'm not letting you off the hook for anything else. But this one thing, it's on me. Okay? So now you're gonna sleep well tonight, because you're gonna be like, someone finally admitted it.
I'm gonna listen to this episode over and over just
gonna play
because
that
of that
one
right
part
there.
over.
Personal accountability.
Yeah. But you know, this is where we hear this sometimes in lectures, and people will say, I like zirconia because the teeth don't break off. Oh man, you know how those teeth break off? I'm like, you're an idiot. Because if the teeth are breaking off all the time, then you don't know what you're doing, man. And
I mean, we know they break off, but they shouldn't break off all the time.
Not all the time. I mean, and you know what I have seen, and I haven't been doing this for 30 years, but I'd say I'd been doing full arch stuff, I don't know, it's 8 years. I probably have the longest case that I've done 8 years, and I'm seeing teeth wearing out, and I love it.
Yeah, that's the problem.
Well, but so what? What's the problem? I gotta reset teeth.
Yeah, you gotta reset it. That's the main problem with bar wrap and acrylic, is it does wear out.
Yeah. I know what you're saying.
Now you're gonna subject to that patient another,
it's $1,000.
Retreading the tires.
Yeah.
I mean, but that's $1,000.
You're right.
You're gonna have to prepare that patient for. And so
absolutely.
That's where this zirconium got this whole thing, is like, hey, but again, what we're hearing here is that it shouldn't be breaking that much.
Right.
Like, we shouldn't be having these problems.
You should be wearing the teeth out. If you that's the failure point. Wear the teeth out. You know, you go back and you open your vertical back up and you reset and rebase it. That's a great problem to have. So I think that it's just important that we like the limitations of some of these materials. The limitation of zirconia is fracture. Well, why is it fracturing? Because people aren't verifying. You know, it's probably not the lab's fault either. Oh, I hate to say that. But it's probably, again, it's a problem of skipping a step. Why did the cylinders come loose? Probably it's skipping a step. So if you think about really a lot of these complications, most of them I feel like are controllable. But one of the things I want to maybe close with here, and I know we don't have a lot of time, but Brad, is there an option between the zirconia or bar wrapped in acrylic or crown and bridge and the, say, locator denture? You know, like the two locator lower or let's use the 2 locator lower because it's a good restoration, okay? But if somebody can't afford a fixed hybrid on the lower, but they have 2 locators as an option, is there something in the middle between those 2? Is there a product that you feel like serves to give you some option that you would tell a doctor to use if they can't afford the full arch fixed?
You know, guys, we've been looking. We've been trying different materials. It's all material. You know, it's the material selections on the market. What we're looking for is a millable material that we could mill tooth color that had, incisal body shade to it, and we could put a pink composite around the gingiva to make it look natural. Something harder than PMMA. We've tried a few, and we've had 0 success. In the last 3 weeks, I've had technicians in the lab from Montreal, Canada, from France, and from Switzerland in the last 3 weeks. And I asked them guys all the same thing because I knew I was going to be on the show, and Wes, you kind of prepped me for this. And even those guys said, we've been looking for the same things, and we have yet to find one that's going to work long term.
All around the world.
So, all around the world. So,
wow.
Unless there's something out there I don't know about, but we've been trying and trying. But again, CAD-CAM generated.
Some of you guys are listening to this and you're saying, well, I've heard people talk about some poor man's hybrid. And I remember one time, probably about, Brad, before you and I started doing the first zirconium full arch restorations, and Lyndon Cooper, I was in a lecture with him, and he was talking about the poor man's hybrid. And basically this in-between option, basically you would take cylinders and put them on transmucosals, say on the lower situation, because that's the most common place for these. And we've got, say, 5 cylinders set across a lower arch with proper AP spread, and then we take and we wax a bar that's basically actually not even wax. You just take bar stock wax, which has a certain dimension. I'm sure it's like 4x4 or something like that. And you wrap it around, just wrap it around each cylinder, and then you cast that, and then you laser weld to the cylinders that cast bar, and then you wax up teeth and acrylic around that, and we call it a bar wrapped in acrylic. But it's a poor man's hybrid because it's not a milled structure. It's cheap chromium cobalt, cheap materials, cheap denture teeth, the whole bit. Yeah, we're going to have some flexing, and like Lyndon Cooper talked about, he said we're going to have more delaminations of acrylic with this. And I asked you about that, Brad. I said, is this that middle-of-the-road option, and what's your thoughts on that?
Absolutely not. I mean, from
Why?
a lab's perspective, it's actually less money for me to make something out of CAD-CAM than it is for me to pay labor to do what you just said right there.
Okay,
it's
so
more
it's
labor intensive. It's labor involvement.
Yeah.
You know,
Right.
It's more cost effective to CAD design and kick it to a 5-axis CNC machine and have it, mill a bar out than waxing and laser welding and the shrinkage of the laser welding. I mean, everything you just said there is incredibly technique sensitive. And if you're a prosthodontist, you had your own lab tech sitting there, I'm sure you do that all the time and successful at it. But in my situation, I'm relying on CNC.
So what about some of these things that we're seeing, like these zirconium dentures that are removable? Like, what's your thoughts on that? Like, John posted a picture on our Facebook page about a month and a half ago, 2 months ago.
So glad you brought this up.
Yeah, like, what's up with that, Brad? Like, removable zirconium prosthetics?
I just gotta wonder what's gonna happen if one time that patient pulls that out and it hits the ceramic tile. I'm not sure, but I'm pretty.
You know what I call? You know what I call it,
in 2 or
guys?
3 pieces.
What do you call this, John?
I call it the Ridge Eliminator.
The Ridge Eliminator. I think that's a showtime.
If you want to melt a ridge within 10 days, guaranteed, just make that restoration full zirconia with locators, man. No posterior locators. No, we don't need that.
No.
The ridge can take it for 10 days. So if they're gonna die within the next week, you can make that restoration, and it's gonna be awesome for like a week. I mean, who are these people? What are they thinking?
These people are not thinking. I don't understand it. Really.
Well, there's so many products though that have these that are being made to try to fulfill this middle ground. We had we talked about locator FTX. We talked about angle corrected locators, which those are interesting. We've talked about even the Fast Protect bar. You can weld the little bars together and make your own little bar. We've talked about these, like you say, polymer materials, Brad. These are all things that are advertised out there, but nothing has really seemed to catch on. I mean, I guess Brad, let's kind of bring it home here with all this. What do you think the future is with full arch fixed restorations? Like, I know you mentioned some of the products. Do you think that that's really where we're headed? We're headed to fully millable products? Or do you see for the foreseeable future that we're still going to be pretty much with these materials that we have today?
No, I think it's progressing, and things are going to advancing. It is driven by CAD/CAM. Everything that's going to be going, I mean, dentures are going to be CAD/CAM for everybody here, I think, in the next 5 years. Everything's going to be either millable or printable type materials. And so I think that's the future of these full arch restorations for sure.
Man, well, it's been a great episode. This has been...
Man, I'm pumped.
Oh,
I just
yeah.
want to go do some more hybrids.
Yeah, exactly. It makes me want to do
Just
some
take some
verification
teeth out.
jigs. Give me some GC pattern. Let me smell it. I'm going to smell it right now.
Man, I love the smell of GC powder in the morning.
I know.
Now you know why all lab techs are so happy all the time, right?
Yeah.
Because we got to
You
deal with
huff
that
and
stuff
glue all
all
the
day
time.
long.
That's right.
Yeah, you glue stuff all the time, you know
Well,
that?
but you
Is that
think...
what's wrong with you?
What do you mean wrong with me?
It's the lab's fault because they huff glue all the time.
That's why it's always their fault. Now
But
I
we actually
understand.
do as well.
Yeah.
We're huffing bonding
Well,
agent all day.
I think that if you are in the early stages of getting into implant dentistry, hopefully this has opened your eyes into some of the things you need to be thinking about. Or if you're very experienced, I'm sure you probably learned something. I sure did. I always learn when I talk to Brad. Brad brings it every single time we talk to him, and we really appreciate Brad being on the show. Thank you for your time you spent with
Brad.
us. I would encourage all of you who are listening to the show to go and connect with us. We want you to go to our Facebook page and like it. We want you to hit us up on Twitter if you have comments or questions, or you just want to send us some love. We especially want you to go to iTunes and give us a review, because that's the way many people find dental podcasts these days, is on iTunes. We want you to tell your friends, your study clubs, your colleague, your mom, everybody about the show, and get people to us so that we can learn how to be better dentists with you, and we could take it to the next level. Because, Wes, I mean, that's what it's all about, right?
Next level, baby. Hashtag.
Hashtag next level. And so for Wes, Brad, and John, we are